Your doctor just ordered a routine test. Sounds harmless, right? A simple screening. Catch something early. Better safe than sorry. But what if I told you that after 70, that simple screening could be the most dangerous thing your doctor does to you, not because the test itself is harmful, but because of what happens next? The follow-up, the biopsy, the surgery, the complications, the recovery that your body at 70, 75, or 80 may not survive. Before I tell you what those 5 checkups are, I want to ask you something. Where are you watching this from right now? Drop your city, your state, or even just your country in the comments below. Whether you're in Florida, Texas, California, New York, or watching all the way from another country, I want to know, because this information needs to reach every single senior in America and honestly, around the world. So go ahead, comment right now, where are you watching from? And if you have a parent, a grandparent, or a loved one over 70, type sharing this in the comments. Let's make sure this reaches the people who need it most. My name is Dr. Sarah Mitchell. I've practiced internal medicine. That means I'm a doctor who takes care of adults and their overall health for over 25 years. And today I'm going to share with you the 5 medical checkups I would never recommend for my patients over 70, not because these tests are bad, but because after a certain age, the math changes and nobody tells you that. Before I go through the list, you need to understand one concept, one idea that changes everything. I call it the Cascade Effect. Think of it like a row of dominoes. One falls and it knocks over the next one and the next one, and before you know it, everything has fallen. Here's how it works in medicine. A routine screening, a regular checkup test finds something. Maybe it's a small spot on a scan, a slightly high number in your blood work, or a shadow on an image. Now your doctor has to look into it. That means more tests, maybe a biopsy where a doctor takes a tiny piece of tissue from your body to examine it under a microscope. The biopsy finds something. Now you're talking about surgery or chemotherapy, strong medicines used to fight cancer, or radiation, where doctors use powerful energy waves to kill cancer cells. Each step carries its own risks. Infection, bleeding, anesthesia complications, meaning problems from the medicine used to put you to sleep during surgery, hospital-acquired pneumonia, a lung infection you can catch just from being in the hospital, falls, delirium, which means sudden confusion where you don't know where you are or what's happening, and cognitive decline, meaning your memory and thinking get worse that never fully comes back. And here's WH. Most people don't realize after 70, many of the things these screenings find would never have caused any symptoms, any pain, any problems in your lifetime. They would have stayed dormant, sleeping. The US Preventive Services Task Force, a group of top doctors and health experts in America who study what tests are actually helpful, explicitly recommends against routine colonoscopy screening for adults over 75 who have already been screened before. Yet millions of seniors over 75 are still getting them every year. Why is this dangerous? A colonoscopy requires full bowel preparation, meaning you have to drink special liquids to completely empty your intestines the day before. Quiet, doing nothing, you would have lived your full life and never known they were there. That is the Cascade Effect. One simple test starts a chain reaction of procedures and treatments that does more harm than the original condition ever would have. Now let me walk you through the 5 screenings. Checkup number 5, routine colonoscopy after 75. A colonoscopy is a procedure where a doctor puts a small flexible camera into your colon, your large intestine, to look for signs of cancer or other problems. This causes severe dehydration, dangerous loss of water and minerals from your body in older adults. The procedure itself carries a perforation risk of 1 in 1,000. That means there's a chance the camera accidentally pokes a hole in your colon wall. That sounds small until you realize that a bowel perforation in a 78-year-old often means emergency surgery, days or weeks in the ICU, the intensive care unit, where the sickest patients in the hospital are kept, and a mortality rate of 25 to 30%. That means 1 in 4 people don't survive it. The benefit? If you've been screened regularly and your previous colonoscopies were clean, meaning no cancer or dangerous growths were found, the chance of developing a life-threatening colon cancer in your remaining years is extremely low. The risk-benefit ratio has flipped, meaning the risks are now bigger than the benefits. What should you do instead if you've had clean colonoscopies in the past? Talk to your doctor and ask, do I really still need this test? Checkup number 4, aggressive cancer screening with PSA tests and mammography. I need to be careful here because this is where emotions run high. Cancer is terrifying, and the instinct, the gut feeling to screen for it constantly feels like the right thing to do. But here's what the data, the real research and numbers shows. For men over 70, the PSA test, a blood test that checks for a protein made by the prostate gland, which can sometimes signal cancer, has a false positive rate of nearly 80. That means 8 out of 10 men who get a high PSA result do not have clinically significant cancer, meaning cancer that would actually hurt them or shorten their life, but they get biopsied anyway. Prostate biopsies, where a needle is inserted to take tiny samples from the prostate, cause infections in up to 5% of cases. They cause urinary problems, trouble urinating. They cause anxiety, stress, and worry that lasts months. And for the cancers that are found, many are slow-growing tumors, growths that grow so slowly they would never cause any symptoms in the patient's lifetime. Treating them with surgery or radiation causes incontinence, meaning you can no longer control your bladder, impotence, meaning men can no longer have sexual function, and a dramatic decline in quality of life. For women over 75, mammography, an X-ray of the breast used to check for cancer, detects cancers that have a very low probability, very low chance of affecting how long they live. The US Preventive Services Task Force found insufficient evidence, meaning not enough proof, to recommend routine mammography after 75. The question to ask your doctor is this: if this test finds something, what would the treatment look like for someone my age? And is that treatment likely to add years to my life or take away from the quality of the life I have? Checkup number 3, routine cardiac stress testing. A cardiac stress test is a test where you walk on a treadmill or are given medication to make your heart beat faster, while doctors monitor your heart to see if it's getting enough blood flow. Stress tests are ordered routinely, regularly, without much thought for seniors, especially before surgeries. But a cardiac stress test in a patient with no symptoms is looking for trouble that may not exist. False positive rates, meaning the test says something is wrong when nothing actually is. In asymptomatic patients with no symptoms over 70 exceed 30%. 1 in 3 tests gives a wrong alarm. A false positive means you now need a cardiac catheterization, an invasive procedure where doctors thread a thin, flexible tube through a blood vessel in your arm or groin, all the way to your heart to get a closer look. Invasive means it goes inside your body and carries real risks. Those risks include arterial damage, injury to your blood vessel, stroke, heart attack, and kidney damage from the contrast dye, a special liquid injected to make blood vessels visible on images. If you have no chest pain, no shortness of breath, no dizziness, and no family history of sudden cardiac death, meaning no close relatives who died suddenly from a heart problem, a routine stress test may create more problems than it prevents. The key question to ask: am I having symptoms that suggest a heart problem? If the answer is no, ask your doctor, why is this test being ordered? Checkup number 2, routine bone density scans, also called DEXA scans. A DEXA scan is a special type of X-ray that measures how strong and dense, how solid and thick your bones are. It's used to diagnose osteoporosis, a condition where bones become weak and brittle, which means they break more easily. Osteoporosis screening sounds benign, harmless, and gentle, and for women in their 60s, it can be valuable. But for patients over 75, the results almost always show bone loss, because bone loss is a normal part of aging. Almost every person over 75 will have it. The problem is what happens after the diagnosis. You're prescribed bisphosphonates, a type of medication commonly used to treat osteoporosis. These medications have been linked to esophageal damage, injury to the tube that carries food from your throat to your stomach, jaw necrosis, a serious condition where the bone in your jaw begins to die, and a paradoxical increase, meaning the opposite of what you'd expect, and unusual fractures called atypical femur fractures, unexpected breaks in the thigh bone that the medication itself can cause. For many patients over 75, the medication side effects are more dangerous than the fractures they're trying to prevent. And the single best intervention, the best action you can take for preventing falls and fractures, isn't a medication at all. It's exercise, balance training, removing trip hazards from your home like loose rugs and clutter, and ensuring adequate vitamin D, making sure your body gets enough of this important nutrient that keeps bones and muscles strong. Checkup number 1, carotid artery ultrasound screening. This is the one that concerns me most. Your carotid arteries are the 2 large blood vessels on either side of your neck that carry blood to your brain. A carotid ultrasound uses sound waves like sonar to look for blockages, buildup of plaque, which is a fatty, waxy substance inside those arteries. It sounds critical, extremely important, but in patients with no symptoms, this screening leads to one of the most dangerous cascades in medicine. A blockage is found. Now you're referred sent to a vascular surgeon, a doctor who specializes in blood vessel surgery. The surgeon recommends a carotid endarterectomy, a surgery where the surgeon cuts open the artery in your neck and physically scrapes out the plaque in patients over 75. This surgery carries a stroke risk of 3 to 5. A stroke is when blood flow to part of the brain is cut off, causing brain damage. The very thing you're trying to prevent the surgery can actually cause it. The landmark ACTS trial, a major, widely respected medical research study, found that in asymptomatic patients with no symptoms, the benefit of carotid surgery was negligible, almost zero in patients over 75. The surgical risks essentially canceled out any potential benefit. If you have no symptoms, no mini strokes, no sudden dizziness, no sudden vision changes, a carotid screening may lead you down a path that ends worse than where you started. Now, I don't want you to walk away from this video afraid of your doctor. That is not the point. The point is that you should be an informed patient, someone who understands what's happening and asks the right questions. So here are the 4 questions every patient over 70 should ask before agreeing to any screening. Question 1, what happens if I don't have this test? Question 2, if the test finds something, what would the treatment look like for someone my age and health status? Question 3, what are the risks of the follow-up procedures, the tests and treatments that come after? Question 4, is watchful waiting a reasonable alternative? Meaning, can we simply monitor the situation carefully instead of jumping into treatment right away? These 4 questions will completely change for the better every medical conversation you have from this day forward. And I want to be clear about something important. If you have symptoms, if something has changed, if you're experiencing pain, bleeding, unexplained weight loss, or new neurological symptoms like sudden weakness, numbness, or confusion, then testing is absolutely appropriate regardless of age. Symptoms change everything. This video is about routine screening in the absence of symptoms. It's about the tests that are ordered because of your age, not because of something you're actually feeling or experiencing. Your body at 70 is not the same as your body at 50. The medical system needs to respect that difference, and now you have the knowledge to make sure it does. If this information could help someone you care about, please share this video with them. Subscribe to Dr. Sarah Mitchell for more senior health content that's honest, clear, and actually useful. And remember, the best medical decision is an informed one. I'm Dr. Sarah Mitchell. Stay informed, stay healthy, and I'll see you in the next one.